Atrial fibrillation, or AFib, is incredibly common in adults, but it's often overlooked during regular doctor visits. Today, family physician Dr. Jen Caudle joins us now to talk about AFib and how you can monitor your heart health at home. And Dr. Caudle, thanks for being here. So first off, what is AFib and how common is it?
Yeah, so atrial fibrillation, we call it AFib for short, is a heart rhythm abnormality. It's where the heart beats irregularly. And this can cause a number of symptoms in some people, not everyone, but a number of people. But the other thing is it increases our risk of stroke by about 5 times, which is a really big deal. It's one of the reasons why I'm excited to chat with you. I'm working with Omron Healthcare to really raise awareness about AFib because September is Atrial Fibrillation Awareness Month. That's why we're talking about it, right? So awareness is key, and Omron Healthcare has this mission called Going for Zero, zero heart attacks, zero strokes. And again, one of the big risk factors with atrial fibrillation is the increased risk for stroke. What I would say is this, when it comes to catching AFib and making sure that we're not missing atrial fibrillation, I've got 3 suggestions for folks. Number 1, make sure you're seeing your doctor, because if your heart's not being listened to, well, we may not be able to find it, okay? And doctors, we can do that when you come in for your visits. The second thing is to listen to your body. Many people with atrial fibrillation will have symptoms, but not everybody does. So listen to your body if you do have symptoms. And the third thing is Omron Healthcare, they have blood pressure monitors that I've had for years, but they have a new device called Complete. It's a blood pressure monitor and an EKG machine in one, available for home use. Utilizing at-home tools to enhance your health can be a great option for many people. You want to work with your doctor and find out what's best for you, but that can also help as well.
Why is AFib often missed and misdiagnosed?
Yeah, so I think a lot of people just don't know what it is and don't know how common it is either. A lot of people have atrial fibrillation, and the risk gets higher as we get older, in particular over the age of 40. Before I talk about other risk factors, let me just talk about symptoms for just a moment. Symptoms of atrial fibrillation can be things like shortness of breath, feeling tired, fatigue, lightheaded, dizzy, feeling like you've got palpitations, your heart's beating out of your chest. But it's also important to remember, not everyone has symptoms. So some people don't have those symptoms at all. And then, of course, with risk factors, as I just mentioned, increasing age increases our risk, but also underlying health conditions, underlying heart conditions, family history, sleep apnea, even high blood pressure increases the risk of atrial fibrillation.
Well, this is a lot of very helpful information, Dr. Caudle. Where can we go to learn more?
Sure, you can go to omronhealthcare.com.